Hi everybody, welcome to our April newsletter. So hope everyone's having a great time over Easter and just a little bit of indulgence, not a great big lot of indulgence. So the target of our newsletter this month is about brain fog and how we can support ourselves cognitively. There's lots of information in the newsletter, so please take some time to read that. And like most things, it can be multifactorial. So your brain fog may be related to your gut dysfunction, it may be related to a hormone change, it may be related to dysregulated sleep, it may be related to nutritional deficiencies. So the role of a practitioner is to help you do a dive into that and work out what's the best way forward to improve your brain fog. But it absolutely is not something you need to accept as normal and ongoing. So if you have a problem with brain fog, reach out. There's 3 of us here. There's always someone that can help. But there is some tips and tricks in the newsletter and things that we use. None of these are specifically for you. It's just an idea. But creatine, which we've mentioned several times before, it's quite amazing. There's quite a lot of studies about this and cognitive function. So that's a really good one that most people can add because you're going to get other benefits of bone density, muscle mass, and cognitive function. So that's just 5 grams a day. So that's a pretty easy thing to add to your regime if you're finding a little bit of brain fog. With students, so often kids in year 12, they're often getting a bit of, it's more mental burnout from the pressure of year 12. So there's things that we use specifically for that cognitive support in times of mental stress where you've got to learn a lot, absorb a lot. So there's things that we'd use there. Our brain uses a heap of omega-3 and is made up of a lot of fats. So good quality fish oils and omega-3s is really important. And remember, we can test your omega-3 levels to see if they're optimal because huge proportion of people do not have adequate omega-3, which is so important for cardiovascular health and brain health and joint health for that matter. Choline, that's a sort of a bit of an unsung hero in cognitive function, but it also has lots of other benefits in the body. So liver health, it's great in preconception for improving the brain of the unborn baby. So there's lots of applications for choline. And if your cognitive decline is, quite advanced, or we're really trying to make some serious inroads, we do use some very specialized products from Japan that are made from a special scallop oil, and there's some good data on them supporting cognitive function. So the takeaway is that brain fog does not have to stay and that it can be caused by lots of different factors. So you need to see a health practitioner to help you unravel what is the cause of your brain fog. And you need to use some diet and some lifestyle and sometimes some supplementation to correct that. But we are here to help. So if that's a problem for you, come in. There's links in the newsletter to book an appointment and we'll help you work through what could be the triggers to this and how to successfully reverse it. So have a great April, everyone, and we'll talk soon.